I think we will move now to our first speaker. I'm really pleased to be able to introduce Dr. Jane Barrett, who, as you can see there, is Head of Health Improvement and Cross-Cutting Research Programmes at the Department of Health and Social Care. And Jane is our main contact person with the Department of Health and Social Care, enormously supportive of the work that we do within the School for Public Health Research, and has been absolutely instrumental in enabling us to expand the research capacity development work that we do. She's also a strong advocate of the importance of practice placements are, as we all. I think it's important to say at the beginning really that many people do public health research, but the School for Public Health Research is probably unique in its very, very strong focus on public health practice. Our raison d'etre is to help improve the evidence base for public health practice. And it's an interesting observation, I think, that many public health academics don't move around very much from institution to institution. And I think the reason for that is that to do what we do requires us to work very closely with our public health practice colleagues in our locale. And it's not just like we can up sticks and take our lab somewhere else. Our laboratory is our local practice community. And so it's a huge thing to move if you're a public health academic. So with that in mind, I'm really pleased that Jane's going to now tell us why she thinks practice placements are so important and what they're all about. Thanks, Jane, over to you.
Thank you, Rona. I'm unable to share my screen with you. Sharing.
I'm going to stop sharing now, Jane. Yeah, sorry.
That's great. Thank you very, very much. And hello to everyone. And that was very nice of Rona to do that in introduction. So the only thing that I would add is that part of my role in the department, as well as being the sort of point of liaison with the department, the NIHR and the school, is that I'm involved in policy research, and there is a lot of similarities in the needs of supporting research for national policy making as there is for local practice. So I'm going to, in order to say a little bit more about why practice placements is particularly important from the department's perspective, I just wanted to give you a little bit of history. So this is just showing you a very key document on the left hand side that very much kick-started a lot of the investment in the department and the NIHR in public health research. So this was the Choosing Health white paper back in 2004. And then on the right hand side, I'm showing you a more recent report that's been very important, which was published by the Academy of Medical Sciences, Improving the Health of the Population in 2040. And that report has very much set the tones for the future direction of public health research, and it contains a number of recommendations, and I'll come back to that in a moment. I will move on to the next slide, and this is just to illustrate the range of things that came into being after that white paper. And the top left hand side is quite important. It was the very first multi-funder initiative called the National Prevention Research Initiative, and it was the first time the major funders of health research, including the department, got together and looked strategically at what was needed. and they agreed to sort of work together over the longer term, and so that funding relationship still persists. And so that there were these other initiatives, which I won't go into in any great detail, but you'll see that this was the genesis of the establishment of the school itself, and the first phase of the school. And the different initiatives had a slightly different emphasis. So the Public Health Research Consortium focused very much on the department and national policy making. The NIHR dedicated public health research programme was very much around supporting the evaluation of interventions. And then something which you may have come across, and Rona and Ashley in particular were heavily involved in the clinical research collaboration for public health research centres of excellence. And they ran until 2019. And so Fuse and Decipher were two of the 5 public health centres. And then the school, which is, focuses on practice. So I think the important thing to say here is a lot of investment began, but the only thing that really focused on capacity building was the UK CRCs. Then in 2014-2015, the funders got together again to review how the MPRI had worked, and came up with a few thoughts on what needed to happen next. So I think 2015 very much starts the beginnings of a different phase for public health research and what was needed. And since that date, I think there's been a lot of momentum. So a couple of things to draw your attention to, which I think are important, is that the funders continued to invest, but they invested in something called the UK Prevention Research Partnership. And that began in 2016. And at the very same time, that was when the Academy of Medical Sciences published this important report that I mentioned at the start. And one of its recommendations was to set up a new coordinating body for the health of the public research. And that's called SCOPA. So you may hear that in your travels. And then last year, the government published a prevention green paper, which was called Advancing Our Health Prevention in the 2020s. And I think that there is a lot of similarity in what was being said in the prevention green paper with the more thorough dialogue in the AMS report, but there were a number of things in both documents around transforming public health research. And a couple of things that came through loud and clear was around the importance of collaboration. By collaboration, what was meant here was the bringing together more closely the relationship between academic researchers and practitioners and policy makers. And working in partnership, so that there was a stronger understanding of what practitioners need and how that could be delivered through academic research. And something that would be important for you to look at, I think, is that in October last year, the SCOPA group, on behalf of the CMOs in the 4 countries of the UK, published a set of goals and principles for transforming public health research going forward. And you'll see that collaboration, co-production come through, and the importance in order to achieve this vision for the future in capacity building. So I've got three excerpts from the documents that I've mentioned. So I'm not going to read them out, but just draw your attention to some particular elements here. So you'll see at the top about the importance of co-producing research with local authorities. There's a real recognition that in order for research to have impact, it very much needs to be conducted or embedded within the organisations who have the decision-making powers to effect change that impacts on the health of their population. So predominantly local authorities hold the levers for a lot of policy change at the local level. Also charities and other third sector organisations. And what we're trying to do, particularly with the NIHR, is try and create an environment that and support research in local authorities in the same way that the NHS has benefited from. And then there's just that quote in blue. The bit I'd like to highlight there is about the importance of career pathways and opportunities for research placements need to be developed and well communicated so that we can bring about a new strong research informed workforce. So I think this is about academics working in practice or having experience of that, and vice versa as well. So the AMS report and in the goals that were published, they do cite that there are some existing good examples of where this sort of transformation and direction of travel is already happening, and the school is one of those that's highlighted. Now, you may know that in the first phase of the school, capacity building wasn't one of its remits, although the school did support a cadre of PhD students, which was great. But with the second phase of the school, these reports and the prevention green paper all came out at a point where the school had started, but we had an opportunity to introduce capacity building. And so this is where the expertise of the school members, and particularly Ashley and Rona's knowledge, were able to kickstart the several schemes very, very quickly. So it's great that you've all been able to benefit from these new schemes, and you're very much leading the way into how academic research can reach out to practice. And my final slide is just to explain that there's a range of things that we're doing in the department more generally around supporting local authorities and particularly around capacity building. We were fortunate back in the March budget that the Chancellor awarded an extra 12 million to the department for the NIHR to focus on prevention research for local authorities. And we've got a package of things that we're experimenting with, because the department's view is that we very much need to try out a range of things and see what works. So we're working with the NIHR Academy on a couple of schemes, and one of them is to try and expand one of its long-standing programs called ICA, which is the Integrated Clinical Academic program. So that's at the beginning stages, but that we're hoping is going to lead to some longer term direction for future careers. So watch this space. So those were the main things that I wanted to say to really drive home how important the department feels practice experience is. And of course, I recognise that it's very difficult in the current environment to do physical placements, and everyone's so busy. But I can reassure you that when Chris Whitty speaks to the directors of public health, they are so excited about the things that we are doing to bring research to local authorities, and they're very keen to engage. If now is probably the best time in many ways, that if local authorities really needed research, it's now.